Hello, this is Kathy Baholik, the infection preventionist for Advocate Aurora Home Care and Hospice. Upon entering the home, we must have our face masked on per universal masking. You want to secure the loops around your ears, secure by pinching the nose bridge, and secure the mask under the chin for proper protection. Do not bring your healthcare bag into the home of any patient requiring transmission-based precautions. Dedicated healthcare equipment, such as blood pressure cuff and stethoscope, are available. Also, ask the patient if they have a thermometer for use. We have disposable ones that we can leave in the home. If additional equipment is required, such as a pulse ox or coag monitor, please bring it into the home in a separate Ziploc bag. Upon entering, if the patient answers the door, I will kindly ask the patient to step away for a few moments so that I may put on my protective equipment. I will enter the home carrying 3 large Ziploc bags. In the first bag, I will have my hand sanitizer, a small Ziploc bag with disinfectant wipes, a few alcohol wipes, and 2 plastic trash bags. In the second bag, I have barriers, my gown, gloves, an N95 mask in a brown paper bag in the event of aerosol generating procedures or any emergencies. My full face shield will be removed from my third Ziploc bag. With our COVID-19 pandemic, it is important to perform my 20-second hand hygiene scrub. Then I will don my eye protection and my full face shield to protect my eyes when we are greater than 6 feet away from a patient. Next, I will don my gown, securing the ties to cover as much of my clothing as possible. Next, I will perform hand hygiene and place my thumbs into the thumb loops before I don my gloves. Remember, it's important to do the full 20-second hand hygiene scrub each time. Once I have donned the thumb loops, I will place my gloves on my hands. I am now prepared to provide care to my patient. If I know prior to my arrival that I need to assist with an aerosol generating procedure, or if the procedure was performed within 2 hours of my entry into the home, I will need to don my N95 mask prior to my arrival. If I did not know that I needed to assist with an aerosol generating procedure, or I arrive with my face mask in place, I will step away from the patient at least 6 feet. I will remove my gloves and perform another 20-second hand hygiene. I next will remove my full face shield and place it on the barrier, and I will remove my face mask and place it in the brown paper bag. I will perform hand hygiene before I reach into my N95 brown paper bag to remove the mask. In order to don my N95 mask, I separate the top and bottom of the N95 mask. I place the mask over my nose and under my chin. Then I pull both straps to the back of my head. One strap goes towards the bottom of my head and the other towards the top. I then pinch the nose bridge securely over my nose and secure the bottom of the mask beneath my chin. Once secured, I will adjust the mask and perform an air leak test. This is done by breathing in and out and ensuring that there is no air leak. If you find that there is an air leak, pull the mask away from your face, reposition it, and once again, secure the mask beneath your chin and over your nose while pinching at the bridge of the nose. And again, perform the air leak test. You can see that the mask is going in and out with breathing, so there is no air leak. I will replace the face shield over my mask in preparation for caring for my patient. Of note, aerosol generating procedures performed in the home require that the patient be separated from team members, family members, including pets, for 2 hours. This is because of the number of air exchanges in the home that are not known. If this is not possible, an N95 mask is required. For example, you need to teach the patient how to perform their nebulizer or suction a tracheostomy or anything else that is aerosol generating. In an inpatient unit with negative pressure, the time is 35 minutes. In a room without negative pressure, this would be 1 hour. Again, in the home, it is 2 hours because we do not know the number of air exchanges that occur in the home. I now do a 20-second hand hygiene scrub and replace the thumb loops over my thumbs before I don gloves. I am now prepared to care for my patient. Once I have completed caring for my patient, I will step towards the door to remove my PPE. I will start with my gown. I will only touch the outside of the gown, grasping the center of the gown and gathering the gown until I break the neck and torso strap. I will then pull off the arms of the gown and dispose in a trash bag. Next, remove your gloves, touching the outside of the first glove and the inside of the next glove, and dispose of them in the plastic bags. Now I will perform a 20-second hand hygiene scrub. Next, remove the full face shield, touching the back of the face shield only, and set it down on the used side of the impervious barrier. Then prepare to clean and disinfect because these are reusable. I will perform hand hygiene again. Now I can don gloves and then prepare to clean and disinfect with the approved product. Remember to check the required contact wet time for cleaning and disinfecting. There are many new products, so please follow the label instructions for use of the product that you are using at the time. Once the face shield is cleaned and dried, it will be placed in the dedicated Ziploc bag for reuse. Always dispose of your disinfectant wipes in a plastic trash bag that will be double bagged and left for patient to dispose of before leaving the home. All infectious or products with bodily fluids require double bagging for disposal in the patient's trash can. I now will doff my gloves and perform hand hygiene before removing my N95 mask. The N95 mask is removed by touching the strap behind the ear, pulling gently, and placing in the brown paper bag. If I did not don my N95 during the visit, I will leave my face mask on. If I did don my N95, I will don my face mask as required, as per universal masking. Now I will perform hand hygiene and depart the home with 2 Ziploc bags, one containing my N95 mask in the brown paper bag and any equipment such as pulse ox, coag monitors that were required during the visit after they have been cleaned and disinfected with the dedicated products. My second bag will contain my face mask. Your computer and your phone were not brought into the home. Reminder, phones and computers are cleaned with alcohol pads only. Once you get to your car, place your Ziploc bag and brown paper bags with your mask in the trunk or cargo use section of your car.